service of CNC Worldwide.
The Daily is a service of CNC and Jib Jab Greetings. I'm Bud Lowell. Your full AccuWeather forecast is always on top on your CNC local pages. Police say the body of a young woman was found late Thursday afternoon in the swimming pool of an Arundecoit home. They believe the body is that of 17-year-old Larry Butler, the Rochester girl who's been missing since Saturday. Rochester and Arundecoit detectives searched 174 Dorrington Road on the east side of town as part of their investigation into Butler's disappearance. They noticed a brick holding down the cover on a neighbor's pool had been moved. Investigators then focused on that neighboring house. The Laurelton Fire Department was called in to drain the murky water, and the body was revealed. Law enforcement officials, including the Monroe County Medical Examiner and District Attorney Sandra Durley, were at the scene. Larry Butler vanished on Saturday after telling her mother she was going to Marketplace Mall with an acquaintance. She never returned. The acquaintance told police he dropped the girl off near East High School that evening. The 174 Dorrington Road home belongs to the grandmother of the acquaintance. He is no longer cooperating with police. University of Rochester Medical Center officials showed off details of the new Golisano Children's Hospital Thursday. They say the $180 million addition to Strong Memorial Hospital will set new standards for pediatric care. The 8-story hospital expansion will be on Crittenden Boulevard. Groundbreaking is planned for late summer or early fall. It's expected to open in 2015. It's being financed in part through a $100 million fundraising campaign. The new building will give pediatric patients and their families private rooms and services that will make it easier for parents to stay rested and nourished while also worrying about their children. Pediatrician-in-chief Dr. Nina Shore says the privacy will be an important factor.
Families need to feel free and open to ask whatever questions they have and not embarrassed to ask something when there's somebody in the next bed whose family may be listening in. And so the new hospital will have private rooms not only for the medical purpose of infection control, but for the family-friendly purpose of allowing a family member to room in with the child and also allowing the family to have some privacy and to be able to discuss things freely with the physicians and nurses and therapists who come by to take care of their child.
A resource library will allow families to learn more about the illness or injury their children have, and a concierge service will assist parents with errands or needs that will allow them to focus more on their sick or injured child. New York State's Commissioner of Health has banned the sale of synthetic marijuana products in New York State. Local health officials are to make sure sales stop immediately. These substances consist of plant material coated with chemicals that mimic THC, the active ingredient in marijuana. They're sold as a legal alternative to pot in convenience stores, smoke shops, and tobacco stores under brand names such as Spice, K2, Mr. Nice Guy, and Galaxy Gold. Dr. Nirav Shah's order says these products have been linked to severe adverse reactions in smokers, including unconsciousness, renal failure, and death. They also commonly cause rapid heart rate, paranoid behavior, agitation and irritability, nausea, and vomiting. The Centers for Disease Control and Prevention have released a study estimating that 1 in 88 children in the United States has been identified as having an autism spectrum disorder. The CDC study released Thursday looked at data from 14 communities across the nation. Rochester and upstate New York were not among the communities investigated, but a Rochester pediatrician says there has been an increased number of diagnoses in this area. Dr. Susan Hyman is the chief of neurodevelopmental and behavioral pediatrics for the Golisano Children's Hospital at the University of Rochester Medical Center. She represented the American Academy of Pediatrics as the CDC made this announcement in Atlanta.
There has been an increased number of diagnoses, and we should be very proud of how we've all worked together, how families have worked through advocacy channels to get resources, how school districts have worked to improve services, how early intervention has coordinated with screening and provision of effective early treatment.
The CDC report marks a 23% increase in autism-type diagnoses since the last report in 2009. Some of this increase is due to the way children are identified and diagnosed in their communities, although exactly how much is due to these factors isn't known. To the left of this window are links to more information on these and other stories. Next news as it happens on CNC, updates when necessary. I'm Bud Lowell, CNC News.